Okay, let's look at this one. Exercise 28.7, number 4. Septic embolism pulmonary artery due to Staphylococcus aureus sepsis. That's the first diagnosis. And the second diagnosis, saphenous phlebitis, right leg. The saphenous vein is one of the veins we could see in our book. And the saphenous vein is used when a patient has a coronary artery bypass surgery, or a CABG, C-A-B-G. So the first part is the infection with the Staph aureus. And I want us to go to the alphabetical index to show you something different about this one. Other times we have used infection with staph as a cause of disease classified elsewhere, which is a B as in boy code. This is not. This is an infection caused by staph. We don't know which side it is. The embolism is in the pulmonary artery, but we don't know where that infection started or came from. So we're just going to code the presence of Staph aureus as an infection in the body. So let me show you in the alphabetical index what that would look like. We're under infection, staphylococcal. This is what we typically have coded as a cause of disease classified elsewhere with these B95 codes. But in this case, it is strictly just a Staph aureus infection. And the default is the methicillin susceptible, A49.01, and the further indentation is the MRSA, A41.02, because our documentation did not mention if this organism was MSSA or MRSA. We code the MSA as our default. A49.01, that's how we get that code. We look up embolism, and then we have to go all the way to the bottom of this column to pick up on pulmonary, right here. And then we're looking for sepsis. So we're under embolism, pulmonary, septic, I-26.90. There's no mention of the acute cor pulmonale in this documentation. So this would be the correct code, I-26.90. And I-26.90, you see, code first underlying infection is an instructional note that we have. If we had looked up the saphenous, phlebitis saphenous vessel here, and you see it refers us to a different path, phlebitis leg superficial. So we go back up here. Just look up a little bit, and it's right here. Phlebitis leg superficial, I-80.0 dash. And the dash is going to be the extra characters that are needed to indicate which side of the body we're talking about. And our notes indicate it is the fifth character 1 to indicate it's the right leg, I-80.01. So this is the path for this particular exercise. Exercise 28.7, number 8, bleeding esophageal varices due to portal hypertension. Hypertension portal is a very straightforward code here. There is an instructional note in the tabular that does not apply to us, so we just simply stay at K76.1. And another word for varices, this term right here, is varix in the alphabetical index. So it's varix esophagus due to portal hypertension, with an instructional note to code first the underlying disease. And we know that the underlying disease is the portal hypertension. So that explains your path for this particular exercise. Here is an exercise not in the coding handbook, and I want to walk this one through you because I think I want to walk through this one with you. When you start reading much more documentation, whether it's the entire medical record or the H&P, the operative report, a discharge summary, maybe some consults, you tend to get a little bit overwhelmed with what you're coding. So it's a good idea to just take it step by step to see the key terms or main terms that you're going to be looking for in the alphabetical index to help you find the answer. Like here, this one, the patient suffered an intraoperative cerebrovascular infarction. Cerebrovascular means in the brain. Cardiovascular means in the heart. So this patient has suffered a brain infarct, intraoperative, during the surgery of this hip replacement surgery for osteoarthritis of the right hip. She has a personal history of breast cancer, had a complete mastectomy last year. Since that surgery, she has had post-mastectomy lymphedema syndrome. So what are we going to be coding? Well, the patient's being admitted because of the osteoarthritis in the right hip. So the osteoarthritis code is going to be the very first code, the principal diagnosis. Then you've got an intraoperative cerebral infarction. There is a guideline that directly relates to infarcts that happen either in surgery or just after surgery. I-97.2 is that post-mastectomy lymphedema syndrome here. And Z85.3 is her history of breast cancer. You could make an argument that that history of breast cancer would not need to be coded because it's not part of the things that are being treated. It wouldn't meet the definition of a secondary diagnosis, but I have it here just because I want you to be mindful that there is a status code. A Z code is a status code for malignancy, history of malignancy. But the argument, as I said, could be made that this would not need to be included. The guideline that applies in this case is intraoperative and post-procedural cerebrovascular accident. And the proper code assignment depends on whether it was an infarct or a hemorrhage, whether it occurred intraoperatively during the surgery or post-operatively after the surgery. It was a cerebral hemorrhage, so the code assignment depends on the type of procedure performed. So you've got the osteoarthritis first. So let's look that up. Osteoarthritis of the hip. Osteoarthritis of the hip is M16.1-, and those extra dashes are going to have to do with us identifying which side of the body we're on. In this case, the 1, 2, 3, 4, fifth character is a 1 that indicates it's the right hip. So now let's look up the infarct, the cerebral infarct. So we're in infarct, cerebral, due to intraoperative, and you see you have two choices of during cardiac surgery or during other surgery. She was not having heart surgery, she was having a joint replacement. So during other surgery is the correct code, I-97.811. Then for your post-mastectomy lymphedema syndrome, this is the path that you would use. And for your personal history of breast cancer, this is the path you would use. So that shows you how you break down your main terms and what you're reading. You think about what your principle is going to be, depending on what brought this person into the hospital. You're going to think about any guidelines that might apply in this situation. You're going to find your codes in the alphabetical index, then look them up in the tabular to see if there are any instructional notes that go with them. Here's another exercise not in the coding handbook, dealing with transplants. The patient presented with a myocardial infarction involving the anterior lateral wall. He received a heart transplant 5 years ago. Since that time, he has had a prosthetic heart valve replaced. So the myocardial infarct of the anterior lateral wall is first. Here I've included an exercise that's not in the coding handbook that deals with the status, the Z codes that are status codes, just to make you aware of using them occasionally and how you might use them. I included this exercise to be sure that you know to code the long-term use of an anticoagulant, just as you coded the long-term use of insulin when you were coding diabetes cases. And this exercise is an example of secondary hypertension, and how that might be coded. And there is a coding guideline that relates specifically to secondary hypertension. And you see that the sequencing is determined by the circumstances of the admission. And this documentation tells us that the circumstances of the admission was the hypertension management. So that would be your first code. So this would be I-15.2 as your first code, and then the acromegaly as your second code. If you did not know that acromegaly was an endocrine disorder, this is an example of when you would use this term with the colon after it in your search bar, and that way you could look up a definition of acromegaly. Let's quickly review that. And you see where I've typed acromegaly in the search bar, followed by a colon, hit enter, and we get all kinds of articles related to acromegaly. But here is a very quick one on the right, a disorder in adults in which the pituitary gland produces too much growth hormone. So the pituitary gland is in the endocrine system, so we know it is an endocrine disorder. This exercise has to do with the patient being seen in the emergency room or the emergency department. You'll see those two used. It used to always be the ER, but most recently, over the last 20 years or so, it's called more often the emergency department. When you are coding cases for patients seen in the ED, you're going to use the outpatient coding guidelines, which is section 4 in your coding guidelines. And you're going to be coding primarily symptoms. If you don't have a confirmed diagnosis, you're going to be coding symptoms. So we do have a guideline specific to an elevated blood pressure without the diagnosis of hypertension. And we also have a diagnosis, or excuse me, a coding guideline to remind us that we don't code diagnoses that are documented as probable or rule out or any of those things that indicate uncertainty. This is different from an inpatient encounter when you would code those diagnoses as though they were confirmed. And our last slide is what we always see in these, being mindful that the exercises in this PowerPoint do not address all of the guidelines. Exam questions may relate to all those guidelines covered in the chapters planned for each week, not just the guidelines covered in this PowerPoint. Always follow your assignment schedule with regard to specific chapter assignments. Post any questions in the discussion board and I will attempt to answer them for you. Thanks so much and have a good day.